At Future Care Capital, we're proud to have been a key partner of the All-Party Parliamentary Group for Longevity over the last year, providing insight into the development of the recently launched strategy, The Health of the Nation. This is a new call to action to realise the government's ambition for everyone to have 5 extra years of healthy, independent life by 2035, and to narrow the gap between the richest and poorest. Tackling these health inequalities is at the heart of the opportunity to drive healthier ageing across our country. So how do we deal with the factors that underpin these issues in practical terms? It was back in 2008 that Professor Sir Michael Marmot was appointed chair of an independent review to propose the most effective evidence-based strategies for reducing health inequalities. The strategy covered the wider social determinants of health, the conditions in which people are born, grow, live, work and age, which can lead to health inequalities. The report proposed a new way to reduce these inequalities in England post-2010. It argued that traditionally, government policies have focused resources only on some segments of society. In order to improve health for all of us and to reduce unfair and unjust inequalities in health, action is needed right across the social gradient. Today, on the 10-year anniversary of his initial review, a new report, Health Equity in England, the Marmot Review 10 Years On, has been published. Some of the key messages emerging from this report are that since 2010, life expectancy has stalled. This has not happened since at least 1900. If health improvement has stalled, it could be a sign that society has stopped improving. When a society is flourishing, health tends to flourish as well. Life expectancy follows the social gradient. The more deprived an area is, the shorter the life expectancy. This gradient has become steeper. Inequalities in life expectancy have increased. Among women in the most deprived 10% of areas, life expectancy fell between 2010 to 12 and 2016 to 18. The gradient in healthy life expectancy is steeper than that of life expectancy. This means that people in more deprived areas spend most of their shorter lives in ill health than those in less deprived areas. This very sobering analysis therefore begs the question, are we in fact going backwards on addressing health inequalities? It's evident that there remains a gap between wealthy and deprived parts of the country. Our ageing population could also compound this divide. If we want to close this gap and develop opportunity for all, the government, businesses and communities will need to respond. The Health of the Nation strategy is a positive and clear call to action in this respect. And the challenge that the demographic shift presents should not be viewed negatively. We should be optimistic about the future. This decade could witness the birth of a new consensus about what it means to be healthy and how that impacts us in later life. Society must grasp the opportunity to build communities where no generation is excluded from the opportunities that tomorrow will bring.